The most common medical emergencies experienced by pregnant patients are gestational diabetes, vaginal bleeding, placenta previa, abruptio placenta, spontaneous abortion, ectopic pregnancy, supine hypotension, and preeclampsia.
What's going on? Hey, I'm the one that called. I'm Travis. I'm a medic. What's going on today?
I just have had this pain for the last couple days or so.
Gestational diabetes is a condition in which a patient who did not previously have diabetes develops high blood sugar during pregnancy. After delivery, the infant is at risk for becoming hypoglycemic. To assess, complete a thorough sample history and check the patient's glucose.
I've also had like a little bit of spotting.
You're 10 weeks pregnant? How's the pregnancy been so far?
Vaginal bleeding during pregnancy can be a sign of a medical emergency or a medical emergency in and of itself. It can be a sign of placenta previa, abruptio placenta, spontaneous abortion, uterine rupture, or an ectopic pregnancy.
Really sharp pain.
For our placental previa, abruptio, spontaneous abortions, any type of vaginal bleeding, how much blood has been lost. The one thing that we never ever want to do is pack something inside the vagina to stop the bleeding. That is just an inappropriate treatment modality. We want to see how much blood there is. We want to determine, are there any clots? Are there any fetal tissue? If they are having an abortion, we need to see what's coming out, because if it doesn't all come out, we need to do procedures in the hospital to fix that problem.
Placenta previa is characterized by painless bleeding. During pregnancy, the placenta is not totally attached to the uterine wall and can shift in position as the fetus grows. As the uterus enlarges, the placenta shifts and can become implanted close to or over the cervix, making delivery impossible without damage to the placenta. Abruptio placenta is the separation of the placenta from its attachment to the uterine wall before the fetus is delivered. The primary symptom is abdominal pain. The amount of visible blood will depend on how much of the placenta is detached. Unlike placenta previa, this condition is very painful and has been described as a tearing sensation. Spontaneous abortion is the complete evacuation of the fetus from the uterus. Symptoms include abdominal cramping, pain, and products of conception. Your call may begin as a response to a pregnant patient with abdominal pain, but both you and the patient may later realize that a spontaneous abortion has occurred. Signs of ectopic pregnancy include pain without vaginal bleeding, shock symptoms, hypotension, and internal bleeding. These patients can develop hypovolemic shock quickly, so prompt transport is indicated.
Blood pressure's 90/60. Let's get the stretcher and let's get this moving.
Okay. One of the things with ectopic pregnancies, many times the ladies don't know that they are pregnant because the ectopic pregnancy usually occurs within the first 8 weeks. What's happening is the embryo has implanted in the fallopian tube versus the uterus, and so as the baby's growing, it's stretching that fallopian tube, so it's going to ultimately burst.
A pregnant patient with supine hypotension can have symptoms like lightheadedness, anxiety, and tachycardia.
When moms are laying flat on their back, they can develop supine hypotension syndrome, which is basically the baby is pushing down on the major vessels in the abdomen and preventing blood from returning to the heart, lungs.
Pretty good. I'm feeling very proud of myself for finally.
Preeclampsia is a condition that can occur after the 20th week of gestation. It is evidenced by edema, especially in the ankles and face, hypertension, and protein in the urine.
Should I call somebody? I think that maybe you should. Okay.
Preeclampsia can lead to eclampsia, a serious condition characterized by seizures. The signs and symptoms of preeclampsia include high blood pressure, headache, nausea, vomiting, visual disturbances, and swollen ankles or fingers.
Hi, Matt.
This is my partner Travis. He's going to be taking some vitals from me here while we chat. Can you tell me what's bothering you today?
I'm just having some really intense stomach pain. It's been bothering me for a couple of days, but today it has been a lot worse.
If you suspect any of these pregnancy-related medical emergencies, initiate supportive care and transport promptly.
Okay, we got a report on the way in that you're pregnant. Is that accurate?
Yeah.
Okay, and so how far along in your pregnancy are you?